If it's happening in New York, New Jersey, or Long Island, hear about it with Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.
Live from the smartwaytobuy.com studios.
Jersey Joe on the radio. It is 7:43 with Piscopo, with Morano Gattulo, Debbie Duhame, Dr. Elena Frid. So kind to come. I'm a huge fan of this gal. All the way from Siberia, and now in New York, top doc in New York, and you get up in the morning, you come live in the studio with us, Elena, yet you have kids, you got, your patients are waiting for you as we speak. You're kind enough to come with old Joe on the radio.
Joe, good morning.
Good morning.
Thank you for having me.
You should be on Fox News all the time. Will you remind me? We'll send a video from here to Fox News. I'll talk to my friends over there. Like, I have trouble getting myself on Fox News, but trust me, I'll take care of you. I'll take care of you later. We'll get you.
I know you will.
It was great. The Rangers game. Are you a Rangers fan, by the way?
I am a Rangers fan.
So,
I'm from Siberia. Hockey, it's a big deal.
It is, right? So we with your family, we were there last week. It was great at the Rangers game. I'm like a Devils fan. Al's like a Flyers fan, and we carried the Islanders and want everyone to see the Islanders at the Barclays Center and listen to the Islanders on AM 970 The Answer. But that was great seeing you there.
That was great. Go Rangers.
Yeah, and your little beautiful children and your husband who keeps saying you got to keep Elena on the air longer. Keep her on the air. Anton's telling me keep her on longer. I go, I'm doing as best I can.
Isn't it sweet? He gets me at home. He gets me at work. And he wants me on the radio.
And he wants you. I tell you, he's a good, dedicated dad, too, which I love,
Yeah.
So, hey, I got to ask you, we talk about opioids with our buddy, Mr. McKenna, Andrew McKenna. That's serious. Do you see a lot of that in your practice now? Because we don't worry about Elena. I know you long enough, and we're like friends with our friend Ray. So I had an appendectomy. Now I worked out too soon. So I think I pulled something. So my doctor goes, you got a slight hernia thing, and he wants to fix it. And then as soon as he fixes it, you know me, I want to get up and running.
Yeah.
I'll probably get opioids, right? Is that what he's going to give me? Painkillers like that?
Probably. I actually don't prescribe too many opioids in my practice for that specific reason.
Yeah.
Of course, I think that some patients do require them, but they have to be used gingerly and appropriately and monitored by a physician regularly. And there are pain specialists who, will see you on a weekly or a monthly basis to monitor that you're not overusing, because it's a problem. I mean, you just heard about how devastating it can be and ruin people's lives.
Yeah. Is there an alternative? Because like Andrew was saying, you could do like Advil or Motrin, but doesn't that cause bleeding?
It can. Again, that should be used gingerly. Just because it's over the counter doesn't make it safe.
Yeah.
And of course, I mean, people are in pain constantly, so you have to get at the root of that and make sure that pain goes away. So it's definitely, there's a field for that, pain management specialist, and if you have chronic pain, definitely need to see someone like that.
I'm afraid to take this stuff. And I'm trying to think, for my appendix, I did not take any opioids. I just wanted to thank God I didn't have the pain. So right. I just avoid it if I can.
It's interesting. I often find that people who actually need painkillers don't want to take them and are afraid. And people who you think should, stay away from them want more.
It's scary what they put in your body, Doc. And I know Dr. Frid is a board-certified neurologist, clinical neurophysiologist, specializing in infection-induced autoimmune disorder. This is the cutting edge of medicine. And before we go on, Dr. Frid, we could find you at where can we find you online?
So online, it's elenafridmd.com.
Yeah.
And my phone number is 212-288-8832.
Because you always, I love the way you go into this, and you with Lyme disease, you cover Lyme disease, you cover a lot of folks with migraines.
Yes.
And again, I want to talk to you about dieting, but on the migraines, if I had more people with the headaches out of the clear blue sky, and then what is this, Elena? It's like sometimes you could see some spots or something, and it's a migraine, but not a painful migraine.
Right. So these are auras or visual migraines, optic migraines. There's different
migraines.
Yes, where you get the aura, but you don't get the headache.
Yeah.
And people can actually lose their sight for a couple of minutes.
Yeah.
Exactly.
Yeah. How do you know about this stuff?
Well,
well, that's what you do. I'm sorry. I mean, I'm amazed at your breadth of knowledge, Elena. So wait a minute, tell me about. I'm such a worrywart. So if you got like your sight, what is causing that? If there's no pain, yet you lose your sight and you have like what is it like?
So this is a loaded question.
Yeah.
Because we think that there's a medical term, this wave of depolarization that happens with neurotransmitters, and it sets on and kind of sets over our brain. And initially, people can develop these auras and sensory problems, visual sensitivity, even hearing issues, where everything is super sensitive, and then may have nausea, vomiting, and then the headache can set on.
Wow. So no pain, and then it's still you lose your sight and everything. Is that dangerous? Is there a?
It is if it's happening very frequently, because you potentially can lose your sight if you're having that, again and again over a course of a month.
Yeah.
Because your blood vessels constrict, and so if you don't get enough blood flow on a frequent basis, that's going to be a problem.
How do you fix that though?
Usually these patients are actually recommended to be on aspirin, either prophylactically or at the onset of the symptoms.
Wow, amazing. Now diets. How do you work out on a regular basis?
I actually don't work out, but I do watch what I eat.
Yeah, well, apparently, because you keep yourself so fit. But diets, what's your overview on diets?
So it's interesting because, as you guys all know, there's millions of diets out there, and the reason
we have the best ones on the station.
And the reason why we have so many diets is that because not one diet is appropriate for every person, and I think there are people who use diets for different reasons: to lose weight, to get more energy, to abort their headaches, to fit into a dress. It depends on what your goals are. Mm-hmm. So I was thinking about the show and kind of what I want you guys to take away from it, and there are really three things that I think we should talk about, which is setting realistic goals, and I think that's often a problem. I think that if you if you want lifestyle modification, like if you have high blood pressure or diabetes or high cholesterol, you really need to lose 10% of your body weight to start seeing significant results of lowering your medication or feeling better. Mm-hmm. And that's something that's realistic, instead of talking about I need to lose 80 pounds or something like that, which is very daunting. That's one thing. Second thing is picking the right diet. So if you love to cook, like a box diet, box meal that comes to your door is not the right diet for you. If you love carbs, probably Atkins diet is not the right diet for you. So I particularly am a big fan in my practice of plant-based diet because of what I do. I'm an autoimmune neurologist, so a lot of what I see is autoimmune diseases and inflammation. And plant-based diet are thought to be anti-inflammatory because foods like dairy, meat, and certain grains like gluten are very pro-inflammatory. But one thing that I do tell my patients is that if you want to see results, typically with diets, you will see results quite quickly, within a couple of weeks, if it's working for you or not. Wow. And so you start feeling better and realizing what foods are good for you right away. When I have patients who come in and say, I've been on this diet for 7 months, and is my memory getting better? Is your memory getting better? If it's not, probably the diet is not working for you. And lastly is be willing to change. So a lot of the times, we have a lot of kind of social rituals around food, and we eat. So people don't realize that sometimes we really even need to change our friends to help us lose weight, because there are studies that are done and that show if your friends have heart disease, you're at a higher risk of having heart disease, just because when you socialize with them, you're kind of doing the same things.
That's a good point.
So be willing to change.
You got to go back to the office. You want to hang into the hour?
I'm going back to the office.
Can you hang a couple minutes? You got to go back. You got to run. You got to run. Look at you. All right. Let's go to Debbie. Dr. Frid, thank you so much. Elena Frid. ElenaFrid.com. You got to check it out. Thank you so much. Great having you on the show. You're welcome to hang, but I know you got patience. Debbie's.
Everybody knows this guy. No, everybody knows he can do a radio show. Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.